Physiological reactions to fasting. The development and evolution of the forms of human pathology are governed by the physiological and chemical reactions that are taking place. Anything that induces such reactions plays a role in determining the state of human health. Whenever food is withheld from consumption beyond the usual period in the case of men or other animals, there are certain changes in the function, chemical reactions and life processes of the cells and tissues. It is these changes which give fasting its therapeutic properties. By considering the physiological reactions to fasting, we can thus gain an understanding of the reasons which determine its therapeutic value. Of great importance among the physiological effects of fasting is rejuvenescence, the acquiring of fresh vitality and renewal of youthful characteristics to the cells and tissues of the body. Evidence of such regeneration comes from many quarters and is particularly impressive with respect to experimental work done with the various forms of lower animal life. Such work may then be given first consideration. The British scientist, Professor Huxley, has carried out experiments with young planaria, more commonly known as earthworms. He fed an entire colony of these worms their usual foods. One of the worms was isolated from the rest and fasted at periodic intervals. In all other respects its diet and mode of life were similar to those of the other worms. The isolated worm lived while 19 generations of worms in the colony lived and passed away. Professor Child, of the University of Chicago, likewise has used worms to determine the effects of fasting. He took a group of small flat worms which had grown old and infirm and fasted them for months, until they had been reduced to a minimum size. Then he started feeding them again, and as they grew back to their normal size, they were just as young, from a physiological standpoint, as they ever were. In his senescence and rejuvenescence, Professor Child remarks, partial starvation inhibits senescence. The starveling is brought back from an advanced age to the beginning of post-embryonic life. It is almost reborn. Other experiments, conducted by F. Schultz, have shown that hydra are rejuvenated by fasting, the animals reverting back to an embryonic state. At the University of Chicago, one insect, the normal lifespan of which is 1 day, was fasted and lived for 15 days. There are some species of lower animal life which normally pass through their lifespan in 3 or 4 weeks, but when, because of lack of food, they are forced to fast at intervals, they often remain young and active for 3 years. Professor Sergius Morgulis, in his experimental work with animals, has noted the relation between fasting and rejuvenation. He states, laboratory as well as clinical experiments corroborated the rejuvenating effects of inanition. If it is not too prolonged, it is distinctly beneficent and may well be used in overcoming somnolence and lassitude as well as in improving the fundamental organic functions, circulation, respiration, muscular strength, or the acuity of the senses. Biologically speaking, though the organism acquires no new assets, it becomes stronger by ridding itself of liabilities. In the foregoing it has been pointed out that the cell nucleus changes in such a manner as to increase the preponderance of the nucleus. Morphologically, therefore, the cells composing the entire organism assume a more youthful condition. They resemble more the embryonic cells in this respect, and this may account for the expansive growth which they display under the proper nutritive regime. One of the characteristics of old age is a decrease in the metabolic rate. It is interesting to note, in this connection, that fasting produces rejuvenation by inducing a permanent increase in the metabolic rate. In experiments conducted at the Hull Biological Laboratory of the University of Chicago, both dogs and humans were fasted for extended periods. In fasts of from 30 to 40 days, a 5 to 6% increase in the metabolic rate was observed. Of course, rejuvenation does not occur in man to the extent that it does in the lowest forms of animal life. However, the effects of rejuvenescence are nevertheless very noticeable in the case of human fasting. Dr. Carlson and Dr. Kund, of the Department of Physiology in the University of Chicago, placed a 40-year-old man on a 14 days fast. At the end of the fast, his tissues were in the same physiological condition as those of a 17-year-old youth. In reference to fasting, Dr. Kund remarks, it is evident that where the initial weight was reduced by 45%, and subsequently restored by normal diet, Approximately one-half of the restored body is made up of new protoplasm. In this there is rejuvenescence. It may also be pointed out that quite possibly much of the remaining part of the body not lost in weight may also undergo significant changes of rejuvenescence as a result of fasting. Mention may also be given to the case of the late Mahatma Gandhi, who was well known for his numerous fasts. On May 18, 1933, when Gandhi was in the 10th day of fasting, he was examined by his physicians. One of the physicians stated that despite his 64 years, from a physiological point of view the Indian leader was as healthy as a man of 40. The outward manifestations of regeneration are quite noticeable in many cases of fasting. The rejuvenating effect upon the skin in particular is important. Lines and wrinkles become less apparent, and blotches, discolorations and pimples tend to disappear. In the words of Dr. Shelton, the skin becomes more youthful, acquires a better color and better texture. The eyes clear up and become brighter. One looks younger. The visible rejuvenation in the skin is matched by manifest evidences of similar but invisible rejuvenescence throughout the body. Literally the word, autolysis, means self-loosing. In physiology it is used to denote the process of digestion or disintegration of animal tissue by ferments and enzymes which are generated by the body cells themselves. Thus it is a process of self-digestion or intracellular digestion. Autolysis forms a normal part of the physiological activities of the body. The action of enzymes upon such substances in the body as glycogen, fatty tissue and bone marrow, in preparing these materials for entry into the bloodstream, is normal autolysis. Likewise, when an abscess points to the surface of the body to empty its contents, autolysis was involved when the flesh between the abscess and the surface was digested by enzymes. While recognizing the existence of autolysis as a common fact of everyday life, it has been generally believed that the process could not be made subject to human control and put to practical use. Though it has been understood that abnormal growths in the body might be absorbed through self-disintegration, the profound change in metabolism necessary to bring about such autolysis has been thought to result only in very rare cases. Following such conditions as extreme cachexia, the puerperium, or menopause. Such conditions, not always being within the realm of voluntary control, and only occasionally producing the changes in question, offer no method whereby autolysis can be instituted at will and put under control. A complete revolution in such orthodox concepts necessarily follows consideration of fasting. The fact is that fasting, in producing a profound change in metabolism, serves as an immediate inducement to the development of autolysis and can thus act as a control of this process. This is no new discovery in physiology, but has been recognized for over a century by those who employed fasting. In the early part of the 19th century, Sylvester Graham wrote that it is a general law of the vital economy that the decomposing absorbents always first lay hold of and remove those substances which are of least use to the economy, and hence, all morbid accumulations, such as wens, tumors, abscesses, etc., are rapidly diminished and often wholly removed under severe and protracted abstinence and fasting. During the fast, the body has the opportunity to redistribute its nutritive supplies, the surpluses and non-vital supplies being consumed and utilized first. The absorption of normal muscles and tissues on a fast is readily observable, and the flesh, blood and bones of a tumor, being less important to the needs of the body, are absorbed much more rapidly, with the essential tissues being utilized in nourishment and the remainder permanently removed. On the fast, the assimilative powers of the body are increased. This is shown both in the improvement of the blood during the fast and the rapid assimilation of food after the fast. Patients who suffer from conditions such as anemia, with either an insufficiency of red blood cells or an excess of white cells, are generally normalized by fasting. In some cases, fasting has brought about an increase in the number of erythrocytes from only 1 million to the normal 5 million count. The explanation lies in the improvement in assimilation which the fast affords. The iron and other elements which are stored in the body are taken up by the blood and used. Prior to fasting, general physiological inefficiency prevented this. Perhaps this also explains why dental decay is often arrested during the fast. In some cases, teeth that were loose become firmly fixed in their sockets while fasting, and swollen, inflamed and bleeding gums are also restored to health. The improvement in assimilation during the fast actually brings about recovery of certain deficiency diseases. Assimilation after the fast is at the highest possible level. Kagan observed that after rabbits were fasted 17 days they gained 56% in weight on a diet which, under usual conditions, would barely be sufficient to maintain a state of equilibrium. People who are chronically underweight in spite of eating very heavily, often gain weight to the normal level after a fast, even though large quantities of food are not taken. The improved assimilation enables the body to utilize more of its food intake. It may be mentioned that it is really a normalization of assimilation which occurs on a fast. Patients who fast to rid themselves of excessive weight may gain weight to normal after the fast, but that is usually where the gain ends if nutrition is proper. Thus both people who assimilate too much of food intake, and those who assimilate too little, are helped by fasting. Fasting affords the organs of the body the closest possible approach to a complete physiological rest. Many organs are overworked and overstimulated, and hence weakened, rough the constant use of defective foods and excessive quantities of foods. During a fast, the necessary work done by the organs is reduced to the lowest possible minimum. As there is no further intake of food, assimilation in the body only involves the redistribution of the elements already stored there. Thus the organs are given a chance to recuperate and restore their vital powers. Repair of damaged structures may take place. Broken bones, wounds and open sores heal much more rapidly. If inflammation is present, it tends to subside. The body undergoes a general healing process. Associated with physiological rest of an organ is increased illumination. This, according to some observers, is the most important advantage of fasting. Part of the energy which would normally be devoted to the work of assimilation may, during a fast, be used to expel the accumulations of waste and toxins. Decomposing food in the digestive tract, which is often an important source of toxins, is quickly eliminated. The entire alimentary canal becomes almost free from bacteria. The nourishment of cells on a fast is first derived from the less essential tissues and portions of impaired and diseased tissue. The surplus material on hand is utilized first. The effusions, dropsical swellings, fat, infiltrations, etc., are absorbed with great rapidity on a fast. The body thus gradually releases itself from a former burden of superfluous and waste material. Increased elimination of toxins is noted on the very first days of the fast. The breath becomes very offensive, and the skin may also emit an offensive odor, possibly because of greater eliminative effort on the part of both the lungs and skin. Catarrh eliminations usually increase during the early days of the fast, until towards the end of the fast elimination is completed and recovery occurs. The toxicity of the urine is increased, perhaps due to greater elimination via the kidneys. In some cases, considerable waste material is lost through the process of vomiting. Of course, each of these symptoms does not occur in all cases, but there is always some outward indication of increased elimination. The primary elimination, however, brought about simply by internal absorption and autolysis, is not apparent in outward reactions, except perhaps the loss of weight and general weakness. A marked improvement in nervous and mental function occurs on the fast. Max Nordau declared that pessimism has a physiological basis, and it may also be said that even the most severe forms of mental aberration usually have a physiological basis. Under the usual circumstances of civilized life, with its nutritive inadequacies and its inclusion of chemical stimulants and depressants, both in the food supply and as drugs for the treatment of disease, there is a tendency to the reduction of nerve energy, or innervation as it is called. The capacity of the brain is also impaired, giving rise to an assortment of nervous and mental diseases. While fasting, all enervating influences are discontinued and the entire nervous system and brain undergoes the same physiological rest that the balance of the body experiences. Nerve forces are restored and mental powers are improved. The ability to reason is increased. The powers of attention and association are quickened while memory of past events is often recovered. Dr. Tanner and others even testified to the development of psychic powers during the fast, which Dr. Tanner felt explained why the old prophets and seers so often resorted to fasting as a means of spiritual illumination. Fasting thus serves many purposes in terms of physiology and chemistry. It produces rejuvenation of tissues, induces autolysis of abnormal growths, improves the powers of digestion and assimilation, reestablishes normal chemistry and secretion, affords the organs of the body a physiological rest, increases elimination, promotes nerve energy recuperation, strengthens the mind, and perhaps improves function in various ways which we do not yet understand. Obviously, these factors are of considerable importance in determining the physical condition of the body. They may mean the difference between strength and weakness, health and disease, and perhaps even life and death.